And tell everyone your name.
Hi, I'm Dr. Seema Nanda from Houston, Texas.
Okay, and what kind of a doctor are you?
I am an optometrist, an eye doctor who helps people see to the right.
And what are you seeing? So, after vaccinations or indeed the COVID shots, are you seeing anything with the eyes?
Unfortunately, yes. What's happening now these days is people keep talking about the heart and reproductive systems and everything, but a lot of things that are also happening in the body are also happening in the eye. And it makes sense because the heart, gives blood supply to the rest of the body, and that blood supply comes through, the aorta and then the carotids, and the internal carotid artery goes into the eye and branches off and becomes the ophthalmic artery. And when it hits that back of the eye, what's happening, just like they're on different body parts, they're shooting off clots or little micro clots behind the eye, and they're calling them occlusions. And these occlusions are called specifically retinal vascular occlusions. Now, these occlusions that keep happening in the rest of the body are also happening in the eye and causing vision loss. Another thing that's happening, not just the occlusions, but another thing that's happening is because the immune response has been dampened, correct? We know that with the shots of causing everybody's immunity to go down. And when the immunity goes down, then the body can't find its way to fight an infection. So strange things are happening. You're seeing herpetic lesions, herpes in the eye. You're seeing other infections, including on the front of the eye, which is the cornea. So I was just talking about the retina, which is the retinal vascular occlusion, which is the back of the eye. The front of the eye is the cornea. And individuals who've had maybe a damaged cornea from something a long time ago, let's say they got an injury like a stick in the eye or something, and they'd have to remove that cornea and give them a corneal transplant. They're showing an increased rate of corneal transplant rejections that they've never seen before. And the reason why that's a big deal is because the cornea is the only body part that it gets its oxygen not from blood vessels, it gets it from the air. And so we get the oxygen from the air. So why is this happening? Because it's avascular, meaning without blood, it has incredibly low chance of getting rejected. It's the only body part that doesn't get rejected compared to other body parts. Like if you get a heart transplant and you get a heart from somebody else, that heart is going to reject it because the body knows it's not mine. But the cornea is different. It doesn't have that blood vessels that are around there that can cause it. And yet there's the report that was done in PubMed research. You can look it up yourself. Don't believe anything that I'm saying. Look it up yourself, because you are your stewards of your own body and you have to pay attention to what's going on. And when people are reporting one after the other incident, and they're not understanding, is this correlation or is it causality? 2 + 2 used to equal 4. Now there's a confusion about it. There's no confusion about this. People are getting injured, not just in the heart, not just reproductive, but in the eyes as well. And this has got to stop.
Now, what about shedding? What do you think about that?
So there is something to be said about shedding, because people who have not been vaxxed are also showing injuries, correct? We've seen this. That means there's somebody in the family that must have had it, or somebody, their coworkers or anybody around it. So again, there's another thing that the immunity is going down in those people. So what you have to do to protect yourself from that viral shedding, and sometimes they say, oh, it's just because of that group where you, what's the word I'm looking for, where you, group immunity, what's the word?
Herd immunity.
Herd immunity, thank you, not
community
group.
Immunity.
Community immunity,
Nonsense.
exactly, yeah, community immunity. Well, if they're constantly creating new variants, you become immune to one, but there's another variant that comes out, which I still don't understand that, 2.0, whatever it is. So you have to protect yourself, and the only way to do that is increase your immunity. One thing is stop watching the TV. That's just poison, okay? That's going to keep everybody worried and keep everybody down. You have to increase your immunity. One huge thing is going out in the sun. They keep saying, oh, UV is bad. UV is only bad if you have a bad diet that goes with it. If you improve your diet, because a Western diet with UV light triggers something. That's the epigenetics they keep talking about. The things in the environment are influencing our negative energies inside. So we've got to clean out that. And UV sun, 15 minutes out in the day in your birthday suit or a bathing suit, maybe you don't want to impress anybody with your birthday suit, but 15 minutes out in the day in the sun will help. Another thing simple enough is vitamin C. Vitamin C is shown to increase immunity very quickly. Squeezing lemon in water, drinking that every day, or squeezing orange in water. Don't drink orange juice. Orange juice is full of sugar and pesticides and glyphosates and all these bad things that you don't want. You don't want anything in a package or a box. Do it yourself. God created this earth with all this beautiful fruit and vegetables and everything. Use that, utilize that. Anything in a box is probably going to be poison. Anything in a package is probably going to hurt you. So don't do that. Go back to whole foods. Whole foods meaning like the whatever the earth produces, the vegetables, the fruits. Another thing is cruciferous vegetables. Now, where does the cruciferous come from? Crucifix. It comes from the cross. So if you cut a vegetable in half, let's say cauliflower or Brussels sprouts or broccoli, all of them have that cross shape. All of those cruciferous vegetables are very good to keep the immunity up and help you heal. So all these things, very simple things, but it's not simple if you don't do it. If your diet is full of junk and fried foods and anything that's, now when I say fried foods also, you have to be careful of that. So oil is not necessarily bad. There's some bad oils which are pro-inflammatory, and then there's some good oils that are anti-inflammatory. And those good oils that are anti-inflammatory specifically is olive oil, avocado oil. All of these are very good. Corn oil, safflower, these are all bad for you. So it increases inflammation in the body and it doesn't allow you to heal. So if you want to protect yourself, not take a pill, I know everybody wants to take something to help themselves. Why don't you take food as medicine? And food is a good medicine. So when you start doing these things, I have an ABCs that I'm working on right now. I'm a professor as well. I lecture to doctors to become better doctors. And I'm finishing writing up the ABCs of long COVID. Now, I think long COVID is a misnomer. Long COVID, yes, it is COVID that doesn't go away, but is more than likely due to the multiple shots and boosters that everyone keeps getting. So when the body finally gets enough immunity to fight this viral injection, I don't call it a vaccine, it's a viral injection. We're injecting part of the virus, the spike protein specifically, into the body. It's the instructions, the mRNA instructions to make the spike protein. And that spike protein keeps proliferating in the body. And as it continues to proliferate, the body keeps trying to fight it off. And then finally, when it's probably killed off most of it, what do? You get another one. And that booster keeps causing that proliferation or growth, hypergrowth of that protein, spike protein, and the body can't fight it off again. So your idea is to clean your body out. Start with the ABCs, anthocyanins. Anthocyanins are things that are purple fruit. That comes from the Greek word anthos, meaning flower, and cyanus or cyanis, meaning dark pigment or dark blue. So that dark blue fruit and vegetables. What are dark blue fruit and vegetables? I can go on and on for this. Red onions, blueberries, those are full of antioxidants. Pomegranate, anything that's polyphenols, it's another fancy name of this subgroup of anthocyanins. Those help. B for berries, all those different berries, the strawberries, the blueberries, the raspberries, all those dark pigmented vegetables. C for vitamin C, you get your lemons, your limes, your grapefruit, all these different things. D, vitamin D is from the sun. E, egg yolk. There was a study that was done, actually Chinese professors, doctors in China in 2020, it was produced, showing that the actual egg yolk neutralizes the SARS-CoV-2 virus, the egg yolk. So why were they pushing egg white omelets and get rid of the yolk? Yolk is bad for you. It's not. It's actually really good for you. So the egg yolk is beautiful. It helps neutralize. And you can take 1 to 2 eggs every single day. Will not have a deleterious effect on your heart. Will not increase your glycemic index for diabetic patients. It's pure protein. It's God produced. It's amazing. And everybody should be eating it every day. F for flavonoids, all the flavonoids that I was telling you about, all the dark pigmented vegetables and fruits, even red cabbage. I know you're like, red cabbage? I like red. Do you think I like red in the family red? I like it. That's the way you remember it. It's wonderful. G, garlic. Garlic is the greatest thing that ever was created, that has the most, increases your immunity the most. And then you can even put it in honey. This is what I tell my patients all the time. put garlic, the cloves, break it up, put it in a jar of honey, let it ferment for a couple of months, and then take that as your medicine. You want 2 tablespoons a day? Fine, you can do that. And everyone says, oh, honey is really bad for you. It's sugar. No, sugar is sugar. Honey is honey. Honey has actually been shown to decrease the effects of diabetes. Don't believe me? Look it up. There's so many things with iodine. Iodine is actually good for you. You need that. When they say non-iodized salt, that is not going to be good for you. J, I think of juice, but I don't think of negative juice. I think of good juices, like pomegranate juice, again in the anthocyanin family. Another thing is join a gym. Exercising actually helps the patient. What? Who would have thought? But it's specifically high interval intermittent training, HIIT, they call it HIIT. So you can walk for 10 minutes and then increase it by do a 2-minute run, then walk for 5 minutes and then 2. So every time you increase the heart rate just a little bit, it causes the cells in the pancreas to grow, the beta cells in the pancreas to grow. That helps you keep your glycemic index down. That also improves your health. And then you have a less chance of even having diabetes. And what goes with diabetes? Cancer. What else are we seeing in the body and the eyes with this COVID shot? Increase in cancer. I can go on and on. Can you tell? I have just so much.
I'm interested.
Yeah, there's so much information out there, and it's just me reading and reading and reading. And I keep getting blown away. Every time I read more, I'm like, this can't be happening. And yet it is. And why are we allowing this to happen? This has to stop. This really has to.
More shots, stroke vaccines, whatever you want to call these things, are coming, and they're coming for the children, they're coming for the babies. So what's your advice as a doctor to the people listening to you now?
Wow. Lots of prayer, that's for sure. But prayer can only help you so far. You have to be the steward of your own health and your own body. My body, my choice, when they keep pronouncing that for everything, it has to come down to this. When I was reading, and I do want to share that piece of paper that I was showing, that the Texans for Vaccine Choice is printed out, and I actually was blown away because I spoke at a rally last year, and in that rally, one of the individuals came up to me, and it was a person who had moved from the People's Republic of California to the great state of Texas. They were trying to get away from the oppression, and one of the big things they were saying, it's like, it was a 3-year-old. He was a little 3-year-old kid, and he said the mom and dad came to me and said, there's something wrong with his eye, and we just don't know what to do. And then, squirmy little 3-year-old, it's hard to see in a chair, but you figure it out. And then I could see there was a little spot on his front of his eye, his cornea. And I asked him, can you just send me your vaccine record so I can see what they've been doing? And in it, I was blown away because I didn't know this. And one of the big things that they have here, and I'm trying to find it in this piece of paper, is they give at birth a hepatitis shot, Hep B shot at birth. Now, when I was in school, my degree is in microbiology. Not only that I became an optometrist, but my undergraduate degree was microbiology. I used to be a med tech in the hospital while going to school. I would do, strains and looking at different things in the body. But when I saw this, here it is. Hep B at birth. Hep B is given to people who have tattoos and are IV drug users. How many babies do you know are IV drug users? And how many moms are IV drug users? You can't tell me that the whole United States population, or at least in Texas, and they give that at birth? This sounds like a shakedown to me. This doesn't sound normal. And then they repeat it at 2 months? And then they repeat it again? I just don't understand it. And there are 59 shots with 77 doses by the time they're an adult. 77 doses of what? I'm gonna say something that may blow most people's minds here. When I was a kid, from kindergarten through 12th grade, I never missed one day of school. I was never sick. Never. I'm still blown away. Why? Because my parents believed in eating the proper foods, doing the right thing. If you have a headache, go to bed or eat something because obviously your sugar is low. There's something going on. But when you're putting these poisons, because they're not been proven, I've just been learning today, and there is a wealth of information if you just go out there and look for it, showing that these vaccines are considered biologics. Now, I've done screenings on FDA clinical trials, and I know the protocols that have to go in place when we're doing, before you go FDA, phase 1, phase 2, phase 3. And but by the time you get to phase 3, you've gone through all the clinical trials before you can put it into a human. These vaccines are considered biologics, and they don't have those strict standards that pharmaceutical medications do. So why are they doing this? What's the point? It sounds like a big money grab to me. In order to take care of yourself, you've got to take care of yourself. No one out there is going to do it for you. Fight for what's right. Do what you need to do, and tell these people, stop the shots. Stop them on every single thing. I used to be, oh, okay, you take your first vaccines when you're a kid. You have to take your mom's measles, rubella. But I'm looking at this bus and how many different individuals that you can see the writing, literally writing on the wall, of how many people have passed away because of this, or had serious adverse events because of this. It's got to stop. And the only way to do that is for you to stand up. I can sit here behind this microphone and tell like what I'm seeing, but you're the individuals. You know what? There are more of us than there are of them, but they scream the loudest, so they win. It's time to stop it. It's time to stop it now.
Thank you very much.
Mm-hmm.